All right, thank you so much for staying with us. You're suddenly watching NTV Weekend Edition. Now, COVID-19 has changed the world quite literally, and now a mask is a compulsory part of the dress code. But as you use that disposable face mask, do you think about how you should dispose of it? Or are you one of those who drop it as you go without a care in the world where it ends up or who picks it up? Before COVID-19 struck, Kenya was already reeling under the weight of its waste burden due to the poor public attitudes and practices. And now, as the country battles to contain the spread of the virus, environmental pollution due to poor mask disposal is brewing another crisis. Environmental scientists are warning of a larger crisis even after the pandemic if the waste from the coronavirus is not properly managed. The coronavirus pandemic has changed life as we knew it. The use of face masks and other personal protective equipment across the world to keep the virus at bay is the new reality. But with this reality, another fight is silently taking place. The poor disposal of these products, especially the single-use face masks.
Waste, especially the PPEs, used masks, gloves and sanitizers, these are now new stream of waste into our environment. And this has really posed lots of challenge to us. But as an authority, NEMA came up with a national guidelines on how to manage the COVID-19 waste.
In the capital, Nairobi, the used masks are steadily becoming an eyesore, becoming one of the most poorly disposed of items alongside plastics and non-woven carrier bags.
These things are clogging up drains. They're not biodegradable. These masks are not biodegradable. And the risk is that this will continue. Everybody in the whole world is wearing masks. And you have to change them frequently. You know, people are using masks for 2-3 days. It means that everybody is replacing these things. Schools have opened, for example. Children will use up to 2-3 masks in a day. So what happens to all of this? And I think it brings us to address a larger problem around how, as a community or as a country at individual level, people manage their waste.
Data by a research scientist at the Kenya Marine and Fisheries Research Institute, Gilbert Atuga, showed that 23.8 million disposable masks are being used daily in the country. This means that 714 million masks are being used per month. As the virus took a toll on the country's healthcare system, this new unregulated product attracted vendors of all sorts. But it is this video that surfaced on social media in April 2020 that revealed a dark side of unscrupulous traders who underestimated the brutal hand of COVID-19.
We have received disturbing news that some unscrupulous persons are recycling face masks after collecting them from bins and selling them to unsuspecting Kenyans. In particular, we've noticed the recycling of the surgical masks, and we've seen different pictures in social media. And we therefore say that this is unacceptable and this is actually criminal. And we shall crack the whip on anyone found endangering the lives of fellow Kenyans for selfish gains.
We had a discussion with those mamas, plus the Korogocho youth, they're called green youths. They were able to sensitize the mama, especially on the impact of this to their health. So I think hopefully they'll be able to really abandon the practice.
I urge Kenyans to undertake basic due diligence on face masks that they are buying so that they do not fall victim.
The situation has been made worse by garbage collectors and recyclers who fear getting infected with COVID-19 while handling waste and end up dumping it in open places. According to the NEMA guidelines, medical waste should be incinerated and counties directed to provide coded bags for disposal of biomedical waste. Unfortunately, garbage collection is privatized in many urban centers, which hinder distribution of the coded bag.
I think counties, especially Nairobi County, has mapped out disposal sites and waste transfer stations. We had seen the inventory of those disposal sites, but I think it's important for them also, for the counties, to put up receptacles that will exclusively handle COVID-19 PPEs. Otherwise, unless we have that specific waste receptacles, it will be difficult for the counties to properly manage COVID-19 waste.
I've seen that some scientists or entrepreneurs are working at developing incinerators that can be used for 20 masks, 1 mask at the home level. But expecting every citizen to be able to access an incinerator, I think that would be that's not really a cost-effective way to go. I would see more helping people to work within their communities to find central places to dispose of things. I think places like gated communities, that is possible. They have central things for central places for depositing other things, and look at ways of improving that.
And as the battle continues, experts say the most practical way of curbing this crisis from exploding in the future lies in the hands of every individual.
What can I do at home to make sure, first of all, that I get into the habit within my household to sort out the waste? Now we have an additional layer of sorting where there's possible contaminated material. Yes, sort out the contaminated material, sort out the recycling material, sort out what you can reuse and give away, and have a nation where we can change as a people.
As an authority, we've come up with the right guidelines and policies, but it's up to the citizen of the country to ensure that they participate in management of this waste. It's a collective responsibility for all of us.